Presentation is about 3D printing use as an innovation for sports medicine and dentistry. I am Dr. Bharat Modi who is going to say that. Prevention is the first thing which we need to do for sports injuries. The stock mouth guards, found mouth guards and custom made mouth guards and the face guards are the different means by which you can prevent injuries happening in sports, whether it is boxing or any other sports. The stock mouth guards are available in over the counter. You can easily purchase them. Some of them are more sophisticated. They have got space so that the athlete can breathe. Oxygenation of the lungs, and then that oxygen reaching the muscles is most important as far as athletes and game players are concerned, and that is why this innovation is required. Unfortunately, these are stock mouth guards, so they are not fitting to that particular athlete or game player. So what happens is that because it becomes loose in the mouth, it becomes uncomfortable for them and they remove it, and then sports injuries takes place because they are not used fully during the entire sports play which is going on, and that is where these stock mouth guards actually fail. The form trays are some where the formation has been done in such a way that the material is get. As you can see in the stock tray, they are made up of rubber, and that is why they transmit all the forces inside. Whereas shoe research people who designed have developed cushioning for the soles. The same technique could be used by 3D printing into the design of our stock trays, so that some amount of cushioning is also available. They don't transfer all the forces inside, so the amount of injury which is there is much less. And this meshwork can be of very small pores or very large pores, and that way amount of cushioning which is there can also be planned depending on what kind of sports it is there. On the other hand, 3D printing gives you a chance to make it customized. For example, if you have the CT scan of that person, the athlete concerned, then you can create the models of that, and from the models you can create a splint for the upper and lower, which could be joined together in occlusion, so that it is very steady when the person is doing his sports work, and then this way a customized to that particular athlete can be made possible, and that is much more well fitting, and the adaptation of that by the athlete will be much greater. And you can also create a gap in that. If you want that the athlete should breathe also, then that also can be possible in the design. So all modifications which are there in the design can be created. At the same time, you can create a mouth guard which is much more fitting to that individual athlete. Now, depending on whether he is a athlete or whether he is a boxer, it will be different. Helmets are being utilized, and the same technique could be utilized in preparing those helmets, rather than going for stock helmets which are available for different type of sports, whether it is fencing or whether it is boxing, whether it is cricket or whether it is for fencing, whatever. So different types of helmets are available, and that could be incorporated with with different kinds of meshes, so that cushioning effect is there. In the stock helmets, this kind of cushioning is not possible, and that is where 3D printing scores over this stock. May be cheaper, but 3D printing will only marginally be more expensive but then it will be fitting to that particular athlete, and that is why his compliance and adaptation of and continuous usage of these helmets will be much greater, and that is where 3D printing scores. Post-trauma, again you can use 3D printing. For example, this particular case where you find that there was a lot of trauma, the external part which was there was repaired, but then ultimately the doctor also wanted to do something about the eyeball, which has the left eyeball had just drooped down and fallen inside because the floor was totally damaged. Now for that particular floor damage, we needed to do some kind of reconstruction possible, so that so that it can be done. So when we saw the radio, we made a 3D printed model. From in the 3D printed model, we found a gap very clearly, and then by reconstruction processes, from the right eyeball, the entire floor was copied and placed on the computer onto the left, and that particular part was trimmed so that it fitted the floor of the orbit of that particular patient, and that was printed as a prototype. So this prototype was kept on a titanium mesh, marked out and cut out. Normally, cutting out and trimming the titanium mesh is the most difficult part as far as these kind of surgeries are concerned. But when you have this prototype, you can easily mark out, remove that. The surgery, which would normally would have taken 1.5 to 2 hours, was finished within half an hour to 45 minutes. And that is the advantage of having 3D printing, because it is much safer for the patient. His anesthesia is less, his timing is less, his recovery is faster, and you get the most fitting and the most precise replacement or reconstruction which is desirable. And since it is titanium, it can be kept in the inside for ages without any problem. Titanium is biocompatible and does not deteriorate. Similarly, you have the problems of leaf-out fracture. Even when you are taking a 3D images or CT scan or a CBCT, the visualization of the cut fragment which is there becomes very difficult because of the overlap. But when you 3D construct it and you prepare a 3D model, you can see all the things, because the question of overlapping doesn't come into picture at all, and you can see how the fracture lines are going, so that reconstruction becomes that much more easier and better in such cases. As you can see, you can cut the maxilla and make it into two pieces, so that the fracture line which is running on the maxillary floor, maxillary sinus roof, that also can be seen very easily in this kind of models. So this makes your reconstruction much more easier. Your surgical planning becomes more easier when you have these kind of 3D models with you before you have started with your surgery, so that reconstruction is better. The next case which is there was again of a fractured side, which was basically in a boxing thing, where the entire side of the skull was damaged because he was hit with a metal rod also. So because of this needed to be reconstruction, the same steps were followed. We created a prototype which could be adapted to the skull, and that skull part was reconstructed, including the zygomatic arch and the frontal processes all were reconstructed, and the patient the brain which had got exposed could be covered. Of course, with replacing as being with titanium. Titanium is very heat sensitive, so the patient will probably have to wear a hat throughout. You must have remembered Mohinder Amarnath, the cricketer, who used to wear that Sola hat because he had that plate, something of that sort. 3D printing is great for different kinds of work, wherever the trauma is there. Trauma could be in soft tissue also, it is not only the hard tissue. So 3D printing allows you to create the bone also, and you can see that there is a bilateral fracture and the infrahyoid muscles have pulled the mandible downwards, displacing it. You can recreate the soft tissues which are there, like for example the salivary gland which is there can be done. All the muscles can be created, so you can know which muscles and how it is attached and how much they are damaged. And even the skin can be recreated in 3D printing. So you know how to do the planning in that particular patient, how to approach the patient for the reconstruction work or the repair work which is needed. And that is where 3D printing scores, because not only it gives you one contiguous tissue, all tissues are there. Segmental mandibulectomy is done many a time because of trauma which is there, and that is why most of the time this segmented mandible is placed by a ready-made titanium plate which is readily available. They are just molded in the to the mandible which is of the patient, and utilized without any problem. Now the problem with these kind of things are that because of mobility there are problems are created. So a titanium sleeve plate can also be utilized in such cases, but then it doesn't allow for the muscle attachments to remain in the same position again, and that is where these plates fail. But you can do with 3D printing, you can do customize titanium modular plates. Instead of having one plate to do that, you can do it in 3 plates, one which is inserted intraorally, one below the mandible and one behind the mandible, and all these 3 can be joined together by the plate which is there, which can be seen out there. With this plate you can fix all the 3 parts together, so that all these 3 parts together will hold the mandible together and allow growth to take place. As you can see from different angles, this allows the muscle attachments to remain in that position, as well as gives stability. The superior part has got a stump also in there. You can incorporate these stumps if you are planning to replace the teeth also. So they will act as your implant, and that could be done. So this is the complete picture which you get of how the plate covers everything, how that implant can be placed on done after the take-up is there. Another method of doing is called as distraction osteogenesis. When there is a gap from the edges of the cut section of the mandible, a segment is cut, and then there is a screw called as IMD expandable screw. Now this is placed, all that planning is done on the mandible which has been created by 3D printing. This technique cannot be done without the 3D printed model which is there. So then the patient every day slowly moves the screw in a particular method, and the cut part of the mandible moves forward towards the other end of the cut segment of the mandible. By doing that, it allows new bone formation to take place, which is shown in pink color here. So as that piece moves forward, new bone keep on forming behind it, and the continuity of the mandible continues to be there till such time as this piece reaches the other segment of the mandible which has been resected, and then it fuses it with that particular by callus formation. Another case where you find that because of trauma, the entire zygomatic bone has been dislodged, and this was dislodged with with the fracture of the neighboring structures also. So this part couldn't be replaced back in the same position, or it could not be immobilized in that particular patient, and there was no hope of this part taking up again or getting repaired. And that is why we started thinking probably we should be reconstructing. So we started with the reconstruction. We reconstructed the portion. Even the side of the maxillary sinus was also recreated. So the zygoma as well as the side of the maxillary sinus, both were created, and a prototype was created. And this prototype was can be given for making it in titanium, so that total reconstruction can be done. And this is how the total reconstruction could be done using 3D printing, so that approximation is possible and it could be fitted with the bones. There are other damages which take place. For example, if you must have remembered how George Foreman chewed off the ear of his opponent during sports. Now, such accidents which are taking place need replacement. Or if a finger is gone, the nose is damaged, the eye is gone, then in all these cases can be replaced by doing 3D printing. This gives you a chance of exact fitting reconstruction of the patient. If only one side the ear is there, you can take the ear of the other side and do it. And that brings us to the question of why 3D printing is not being used. I call it an iatrogenic suicide, because knowing that this technique and this process is available, we still don't use this technique in our day-to-day patient care, whether it is sports medicine or general medicine or general surgery or dental surgery, whatever. For example, this plate which have been utilized, this was the same case where I showed you the customized this thing. 3 times this plate was removed, 3 times this new plate was and still it did not work, and that is why we went for the customized plate. So failure is very possible in this. Many a times, because the bending is done too much, it creates stress, and after some time when the mandible starts moving, the thing breaks. Many times in osteogenic surgeries, osteognathic surgery, orthognathic surgery, what we do is we cut the maxilla, bring it forward or backward. But this maxilla sometimes doesn't take up because the planning is not proper. Without models, if you start doing the planning, then it is like hitting on the top of the head. In this particular patient, for nearly 1 year, the upper maxilla was floating. So using 3D printing, using models is much more better than doing that. What is the help? Rehabilitation is proper. Reconstruction is exactly to what it was previously. There is precision, so it is helpful both for the patient as well as the doctor. Safety is most important, because patient is most safe because you are doing it in a short period of time, and there is enhancement of the aesthetic value also. Many a times in sports, you need to see to that there is enough oxygenation, and for that you need to study the airway of that particular athlete. That is the part of training of the athletes. So we can reconstruct the entire space of the airway along with the tongue and everything, so that you know what is the oropharynx space, what is the nasopharynx space. All this can be recreated by 3D printing, and so that the patient, the athlete which is concerned, is benefited. So these are the things which can be done with 3D printing. These are just the few of the things, but there are many more things which can be done with 3D printing, depending on from case to case what differences are there. Accuracy of 3D printing is great. As you can see, through the mandibular canal, a wire has been passed and it easily goes through. So having worries that it may not be exact, I may have difficulty, that does not have a place as far as 3D printing is concerned. Today 3D printing is very accurate, especially for dental and medical work. Maybe for architecture and engineering it may not be. Thinking out of the box is required if you have to start using 3D printing, because routine dentistry, routine medicine is something which you would do blindfolded also. But when you want to use 3D printing, you really need to have a different way of thought, because that is what is going to help your patient. Patients are going to be helped because of that. Thank you very much for patiently listening to me, and go for 3D printing. That is what is the need of the hour today.